military, the CRNAs have full practice authority, and that's in all the services, and we can practice to the full extent of our education and training. It's not because we had special training in school. We all have the same education in school. The difference is in the military, we are encouraged and required to practice to the full extent of our education and training. In my case, deploying to Afghanistan, I was the sole provider for anesthesia in a forward operating base.
I spent 21 years as active duty, and half of that time I was a CRNA. I did deploy while I was active duty, and one of those deployments I was actually the sole anesthesia provider for the whole entire area of operation.
I had the wonderful fortune of being in the Navy for 26 years, 4 months and 1 day, but who's counting?
In the military setting, I basically did everything start to finish. I did my own preoperative evaluation of the patient, I developed my own plan, executed the plan, and then was responsible for postoperative orders and management in the recovery room.
And all my equipment in a backpack. I spent all that time in the military, completely independent, doing my own anesthesia, often side by side with my physician colleagues.
When I came home and took my uniform off and came back into the state of Virginia, I was no longer allowed to practice independently. Everything was cut off at that point when I came home.
And I retired from the military and went into the civilian world. I found the practice to be very restrictive. I've had a lot of training. I've proven that I can take care of very ill patients. I can certainly take care of patients stateside as well, and I wanted to continue to practice in that environment.
There is a difference when you come back. Supervision in Virginia is actually very loosely defined. We can be supervised by any physician, dentist, or podiatrist. And none of these individuals have any training in anesthesia, airway management, or just the practice of maintaining hemodynamic, meaning blood pressure and other health issues that a patient may have.
Being able to practice independently, but then also to know that your opinion, your expertise is valued, is a great feeling.
I do believe that Virginia is losing CRNAs because of the supervision requirement. The military CRNAs get trained to practice independently, and so the civilian ones do as well. And if we could all practice to our full scope, then for example, if you had an 18-room OR and you have 10 CRNAs and however many anesthesiologists, you could run twice as many rooms if everybody did their own anesthesia, rather than having an anesthesiologist have to supervise 4 CRNAs, right? You could have that anesthesiologist also doing cases, and you could actually increase the access to care.